equitably sharing of rapid tests, therapeutics, oxygen, and vaccines are key to ending the acute phase of the pandemic. That means tech transfer, sharing know-how, and waiving intellectual property rights.
The surge of COVID variants across the country, the Brazilian, the South African, and the UK strains, serve as a constant reminder that this is a global pandemic, and much of the response has been coordinated by the World Health Organization, an organization that has been widely criticized in the early days of the pandemic for relying on false information from China. Now, a report on the origins of the COVID virus has drawn criticism from a number of countries, Canada included. But now, the turn is to the race to vaccinate people all over the world. And again, the WHO is at the center. Should drug companies do more to get vaccines to all countries around the world? Are the variants here to stay? Does the world need a better early warning system in the future or vaccine passports? Let's find out. Joining me now is the Special Advisor to the Director General of the WHO, Dr. Peter Singer. And as you can see by the Order of Canada on his lapel, he is, of course, Canadian. Dr. Singer, great to have you on the program. How concerned is the WHO about the slow rollout of the vaccines that not just here in Canada, where it's been a big political and a health issue, but in low and middle income countries as the variants are gaining speed, danger, and traction?
This is the number one issue, the number one concern of WHO, vaccine equity. About 700 million doses have been administered around the world, Evan, but in a very uneven way. The vaccination coverage in high-income countries is about 5-fold larger than in non-high-income countries. And that's a very serious situation. It's for ethical reasons, for economic reasons in terms of restarting the world economy, and I would say also for peace and security. And so the WHO is working hard on vaccine equity, including through a partnership called COVAX, which has distributed 38 million doses to 100 countries.
Canada has contributed over $440 million to that, but Canada is the only G7 country to exercise their option to take doses from COVAX. We got 1.5 million doses of AstraZeneca from COVAX. Some have accused Canada, Canada's allowed to do it, it's part of the rules, but for violating the spirit of COVAX, which was really meant to help, as you said, vaccine equity in low and middle income countries. Was it right for Canada to exercise their option and take those doses?
Canada is a top contributor to COVAX, both in terms of dollars and in terms of actual engagement and participation. And on balance, COVAX is the world's best distribution mechanism for fair distribution of vaccines. You know, when we talk about vaccine equity, 3 things can be scarce. Dollars, and we've got a $22 billion shortfall in the Access to COVID Tools Accelerator, of which COVAX is a part. That's not a lot of money compared to the tens of trillions of stimulus spending. Doses, 38 million doses distributed, and we've put out a call for countries to share doses so they can be equitably redistributed. And domestic manufacturing, that's really the midterm solution, Evan, because the choke point at the moment is supply. Better supply will mean more doses distributed, more vaccine equity, and helping the world get out of this terrible situation as quickly as possible.
Well, you mentioned domestic supply. Look, Canada doesn't have a domestic supply. That has been our choke point, and that has been a hugely controversial political issue here. But many countries around the world don't either. And in fact, at the World Trade Organization, there was a vote that over 90 countries voted for to actually have the big pharmacy companies who used public money to develop these vaccines to temporarily drop their patents so low and middle income countries could create generic versions of this and up their domestic supply. Canada refused, didn't want that vote to happen. They're trying to delay that vote, which has shocked a lot of people like Stephen Lewis. Should, in your view, Canada support this vote to make sure that the patents should be temporarily dropped so low and middle income countries can get into the domestic production of these vaccines?
Canada should support domestic manufacturing at home and abroad. You know, there's a long history of this. Think about the Avro Aero, think about Connaught Labs. And so this is an issue in Canada, it's an issue around the world. WHO is pursuing 4 approaches on this. One is partnerships on fill and finish, you know, the last stages to get the vaccine in bottles, et cetera. Secondly is the bilateral partnerships, like the Oxford AstraZeneca. and Serum Institute. Thirdly, and this is probably a really key area, is coordinated technology transfer. And then finally, intellectual property. And WHO has supported India and South Africa's move at the World Trade Organization to temporarily suspend intellectual property rights. I think Canada should and will hopefully support domestic manufacturing at home and abroad, because that's how to up the supply.
Right.
That's how countries can be self-reliant. That's how to achieve vaccine equity. And that's how to end this pandemic and help us prevent and respond to future ones, and they will come.
Dr. Singer, vaccine passports become a big issue as more people are getting vaccinated. There's a real debate around the world. Will you need a vaccine passport to travel? There's a lot of controversy about these. What is the WHO's position on the vaccine passport?
In January, the committee that advises WHO under the international health regulations did not support vaccine passports for two reasons. One is the evidence at that time was clear that vaccines prevent death and bad outcomes, but it was evolving in terms of whether vaccines prevent transmission. That evidence has evolved since January. Secondly, there's a real risk of inequity, of making inequity worse, both internationally in terms of international travel and domestically in relation to vaccine passports. And we want to actually reduce inequities, not increase them. Having said that, that same committee is meeting again in April, will reconsider the evidence and potentially reconsider its position.
The WHO has been heavily criticized because it relies on information from contributing countries like China. That becomes political. There's lots of accusations that China lied about this. They kept doctors out. They kept the world away from Wuhan originally. And when countries like Canada are accepting information from the WHO, if that information ain't any good, as you know, that means there's a slow response, that means borders aren't closed and people's lives are lost. What needs to change?
WHO's only had one consideration, Evan, since it first heard of this response, and that's saving lives. And it saved a lot of lives. The world would be a lot worse off without it. Every country, every organization can learn, and there's an independent panel, for example, that's looking at WHO will learn, but also the national responses. You know, there's a 50-fold difference in cumulative mortality across even G20 countries, so we all have a lot to learn. And then thirdly, you know, it's countries, it's governments that design the system, because governments are WHO as well as the Secretariat, and there is an attempt to do a pandemic treaty to translate some of those lessons learned into preventing future responses.
Dr. Singer, I appreciate your work, and thanks for taking time to speak to us again. I always appreciate it.
It's great to be with you again, Evan. Thank you very much.